Good morning, everybody. Hope that you are very well. Today, I am continuing my series on the head to toe MOT of your baby. And I am on day 16, I think, of my 21-day live. So today, I am going to be talking about reflux and the difference between this and gastroesophageal reflux. So let's begin with reflux. So reflux is a very common thing that we see in babies. And it is due to the fact that the esophagus, which is the food pipe and the opening to the stomach, there's a little muscle there that is quite loose in the early days of being a baby. And it gets stronger as your baby gets older. So it's not uncommon for your baby to posit or regurgitate after a feed. And this is known as reflux, and it's very common occurrence. And your baby will normally grow out of it. Now, we don't have to worry about reflux when it's not affecting the baby, in that they're happy and smiling, they're gaining weight, and everything is absolutely okay. Now, the difference between that and gastroesophageal reflux is very different. So gastroesophageal reflux, we shorten it to GORD, G-O-R-D, in the medical profession. Now, this is more common in babies that are premature because that muscle hasn't developed properly, and also in low birth weight infants. But we will also see it in children that have muscular problems such as cerebral palsy. Now, how do you recognize gastroesophageal reflux or GORD? Well, the positing or the regurgitation just doesn't happen at meal times. It happens throughout the day. Now, when it happens throughout the day, this is significant because when the baby regurgitates, the acid within the stomach starts to come back up and causes the baby discomfort, and they will cry and be irritable. Now, often they will refuse feeds and they won't be gaining weight, and they will be just generally unhappy and unwell. And often they have associated hiccups with it, and some babies do get ear infections with it as well. So if your baby is having those sorts of problems and it's persistent and it's happening throughout the day, this is more likely to be a gastroesophageal reflux disease, which is a longer term problem that needs to be sorted out because it will impact on your baby's weight gain. So what do we do about it? Well, there's a number of ways that we can manage it. And I would start off with kind of the less intrusive things first, and medications. So we'll always go with first line treatment. So to minimize the gastroesophageal reflux, what you can do is make sure that you feed little and often, because babies often cope better and it decreases the reflux if you give them small amounts rather than a big amount of a full bottle, for example. It will also help if you sit them upright during a feed so that their head is higher than their tummy. It's less likely for the reflux to happen. And make sure that you wean them well in between the feeds and at the end of the feed as well. I would recommend that you sit them on a head up tilt after a feed. So pop them in their bouncy chair or in whatever chair you have, a swing or something like that, so that the contents of the stomach can really just settle before you put them straight to sleep. Now, if you are putting them down to sleep straight after a feed, I would recommend that you put them again on a head up tilt, but you need to elevate the whole cot or the Moses basket. I don't recommend that you roll a towel or muslin or anything under the mattress, because this can sometimes be associated with sudden infant death syndrome, and I don't want you to be worrying about that. So that's the kind of first management of the symptoms. But if you find that things are not getting any better with those kind of non-medical interventions, then it is time to see a GP. Now, you can get thickened milks over the counter, actually, without prescription, that will often help keep the contents of the stomach down and less likely for your baby to reflux. So that would be the second line to get those thickened milks. And there's a number of them on the market that you can buy. They're called anti-reflux formulas. But if that line of treatment doesn't work, then we do go to the medications. Now, the first medication that we can use in babies is Gaviscon, which is an anti-reflux drug medication. And what it does is it helps line the esophagus or the food pipe. So if the baby does reflux, they don't get that acid burn, which is really causing your baby the discomfort and the pain after a feed. And sometimes this can work really well. It just gets rid of all of that discomfort that the baby has following a feed. And the last line of treatment really is ranitidine. And this is a drug that actually decreases the production of the acid within the stomach. And this will be our final line of treatment, really. We often find, as I said, that reflux gets better as the child gets older, because that muscle that is opening into the stomach gets a lot stronger, and the contents of the food, of the milk, can stay down much easier. And we also find that it improves as well as your baby starts weaning onto solids, because the solids also help to weight the milk down in the tummy. There are rare occasions when your baby may need to have surgery, if the reflux is particularly bad and your baby continues to lose weight. But that is very rare, and we tend to only see that in babies who have an underlying health problem like cerebral palsy, for example. So those are my top hints and tips, really, on the difference between innocent reflux and gastroesophageal reflux disease. Just to let you know also that you can have a condition called silent reflux, where the baby is still having the reflux, but it's not actually coming out, and the baby's not vomiting. And they will have still all the signs and discomfort of a baby who's actually regurgitating or refluxing the milk out onto their clothes, or indeed on the floor. But in silent reflux, you don't have that happening. So it can be a little bit disconcerting if you can't see the milk coming up, but it's still coming up the esophagus, but the baby is actually swallowing it back down. And again, it's burning on the way up and burning on the way down as well. So they get a double whammy, so they will still have considerable discomfort. Okay, so I hope you got some value from that. Please do comment or like, and tomorrow I will be in my group talking about skin rashes, and that seems to be a big issue for lots of parents. So if you want to know more about skin rashes in your baby, because there's so many of them, I will be in my group tomorrow. So if you haven't joined me in my group yet, please do come on over. I will put the link in the comments. Until then, have a great day and happy parenting, everybody. Take care. Bye bye.